Thank you, Natasha, and thank you everyone for joining us. It's going to be a great evening, I will tell you. We have the illustrious Dr. Kristi Funk, who is a double board certified breast cancer surgeon, lifestyle medicine physician, best-selling author, and international speaker. She graduated from Stanford University in 1991, received her medical degree from UC Davis, completed her surgical residency in Seattle, and a breast cancer fellowship at Cedars-Sinai in Los Angeles. She excelled as a director of the Cedars-Sinai Breast Center until 2009 when she co-founded the Pink Lotus Breast Center in Los Angeles, where she currently practices. She has helped thousands of women navigate breast issues, including celebrities like Angelina Jolie and Sheryl Crow. Dr. Funk's nutritional science expertise sparked twin passions: the online women's social network, Pink Lotus Power Up, which features her cooking show in the Cancer Kicking Kitchen, and her annual in-person or virtual Cancer Kicking Summit. She is the go-to breast expert for Good Morning America and Dr. Phil's Merit Street Media. She was co-host of the Doctor's TV show and has repeatedly appeared on Today, Rachel Ray, The Dr. Oz Show, CNN, The View, and more. She resides in Los Angeles, California with her husband and triplet sons. Welcome, Dr. Funk. It is a rich privilege to have you on our Spotlight in Health this evening.
Well, thank you, Dr. Hollie, for having me. I'm very grateful for the opportunity to talk, and I've been following the Center for Nutrition Studies ever since I dove into plant-based eating, and I offer their website and tools to all of my patients. It's a tremendous resource. So for those of you who don't ever log on to the site and navigate around, I encourage you to do so. It's tremendous, the work that they do.
Great, great. Thank you. Well, I want to start with this question. Tell us how a surgeon became interested in nutrition and lifestyle and the effect that it has on preventing, reversing, and treating chronic disease. This is unique.
It is. I will say, no offense taken for the tell us how a surgeon, and I will tell you that Caldwell Esselstyn is a surgeon. He was in fact a breast surgeon, and I've had the opportunity of hanging out with him in his house, and been a part of their family gatherings a few times, and it's just, it warms my heart that I have like at least one other surgeon. Garth Davis, he's a surgeon. He's a big giant in plant-based space, but there are very few of us. We are few and far between. Not sure why that is per se, but my story and journey toward this lifestyle medicine sort of began when I was director of patient education at Cedars-Sinai of the breast center there, like you mentioned. And I would go do these community lectures. Literally, there'd be like 5 people there, I'm sure, for the free pens, and not to me at all. Like, it was hard to get their attention, keep their attention. And so I realized quickly that the reason largely was that I was talking about breast cancer, what it is, how to treat it, how to cure it. And nobody wants to know about that unless they or someone near and dear to them is currently grappling with breast cancer. Otherwise, it wasn't interesting to know, like, this is what cancer is. You could do radiation, you could do surgery. So I started to dive into more preventive strategies, and then I throw out some zingers like, did you know that 3 cups of green tea a day can decrease breast cancer by 50%? So I started to realize, wait, there are some actual nutrition studies and facts out there that are interesting, but I was so consumed by my surgical career and the business of medicine that, except for when I went out to lecture, I wasn't really like internalizing those pearls. It didn't set off the light bulb until I started to write my book. So I have a national bestseller called Breasts, the Owner's Manual. And when I went into the nutritional science to write chapters 3 and 4, which is about what to eat and what not to eat, I was approaching the science really just with an open mind, but not really, because I was there to corroborate the way I had been eating my whole life. Like, I was sure I was right. I mean, I'm a product of the 80s. I was a teenager in the 80s where bread, pasta, rice, and potatoes made you fat. And so you ate low fat, but I also knew like tons of fruits and vegetables. I was always big on exercise. So I felt like I was going to find out that the Mediterranean diet was probably the best way to eat. And when I went into that science, I was just mind blown about how rock solid the evidence is. in major journals, right? We're talking about JAMA and Lancet, not Leafy Green magazine that no one's heard of. These are reputable peer-reviewed journals with solid science showing not only that plant-based eating would be the healthiest way to eat, but showing me for the first time, because it's the first time I looked into it, how detrimental animal protein and fat is to essentially every organ system in your body and leading to all of our major killers, heart disease, stroke, diabetes, Alzheimer's, and cancer. So that's when the light bulb went off. That's when I realized that I could be so much more impactful in my patients' current and future lives by giving them a very solid, scientifically backed path to follow that went beyond surgery, radiation, and chemo, which is where it usually like just ends for people. Their doctors say, "Oh, sweetheart, you've done everything you were supposed to do. You just go live your life." And now I have really clear ways of teaching people, look, that's the last thing you want to do, because everything you were doing in your life until the moment of cancer
Right.
was
Right.
somehow creating a microenvironment conducive to the cancer that formed. So you can't just do a nuclear bomb and treat the cancer and then revert back to the path you were on, because it's not a healthy one. And I have ideas for you. I have strategies and I have resources that can help you stay on a new path. So it's been transformative. And that was, I was working on the book and came to this conclusion in 2017. So it's only been 8 years, but it's been a powerful 8 years. I mean, sorry to everyone who used me as a surgeon for the prior 15 years before that. I didn't know what I was doing, but I didn't have as much empowerment to provide. And it's made work so much more exciting. I love every day. I wake up excited to see who I'm going to meet today.
That's great. That's great. So let's dive into breast cancer now. And correct me if I'm wrong, but I believe in recent years, breast cancer has surpassed lung cancer as the number one cancer diagnosed in women. Is that correct?
Yep, in 2020, we
2020.
we
Okay.
women soared to the top of all cancer on the planet. So there are about 2.3 million new invasive breast cancers every single year on the planet, with about 685,000, largely women, dying year after year from breast cancer, which is pretty staggering because there's no end in sight. And if you want to go through some quick stats in our own backyard, thinking just about the US, this year we'll have approximately 310,000 new invasive breast cancers, 55,000 ductal carcinoma in situ, which is stage 0 and thankfully completely curable, but we could dive into that. We definitely overdiagnose and overtreat breast cancer as well. So there's sometimes problems with finding it too early when it would be insignificant, and then it becomes very significant because you're doing all of these things that are basically taking a sledgehammer to something that just needed a little tippity tap. But we don't always overtreat. Sometimes certain cancers, certain biologies really warrant it. Among those 310,000 with invasive cancer, each year we deal with 42,250 deaths from breast cancer. If we have any men in our audience, or I'm sure we have women who know good men, they too get breast cancer. They don't realize that they have breast tissue, and they're often diagnosed at later stages because they're unaware that this like lump or pain could be something sinister. 2,800 men are diagnosed every year in the US, 500 die every year. And overall, the stats are that 1 in 8 women gets breast cancer. That's about 13.1% of us. And 1 in 43 women dies from breast cancer, which is 2.3% of us.
Yeah, staggering numbers. Yeah. And, one of my pet peeves all along has been I believe in Cancer Awareness Month in October. I get that. It's important. But I often thought we need cancer prevention, breast cancer prevention month. And well, let's talk about that. In a 2024 survey, only 28%, only about a quarter of women are aware that a healthful diet can actually lower the risk of developing breast cancer. In 1995, 23%. So it's not changed much in 29 years. So what is your take on this information?
Right. Okay. So, well, first of all, to your point, we women do have breasts all year long, so we
Yeah,
shouldn't just pay attention in October.
exactly.
This is a fabulous study. My take on it is that it's really exciting. I know that sounds bizarre. You just said that in almost 30 years ago, 23% of people were aware of the association between diet and breast cancer, and now
Right.
3 decades later, it's 28%, which is embarrassingly low. That
Yeah.
same study, by the way, also had horribly low awareness between other behaviors and breast cancer. Only 14% understood that smoking and alcohol were connected. Only 14%, again, associated exercise with a decrease in breast cancer, and a paltry 4% acknowledged that being overweight or obese associated with breast cancer. So this study was really powerful. The reason why I find it exciting is I saw a meme the other day, which I shared with my kids. I got no laughs, but I think I might get one from you. I thought it was
I'm
fabulous.
already laughing.
Thank you. And it was just this dad sitting there with a coffee cup that said greatest dad. And then the headline said, I don't mean to brag, but everything I told my daughter today, she already knew. Right? So
That's good.
and I bring that up here because what if the opposite were true? And 90+% of respondents said, oh yeah, I know diet is associated with breast cancer. I know that eating animal protein and fat is associated and that I should eat plant-based. And yet look at the behaviors, right? That would be extremely discouraging. What I see from this is that we haven't done enough work in the last 30 years, but we have so much room for education and improvement. It's not yet a resistance to change. It's, I didn't know I was supposed to change. I thought I was doing well. Kristi Funk, just in 2017, before I did a deep dive, thought that eating lean meats like chicken, turkey, and fish with tons of fruits and vegetables and limited whole grains, because I was still anti-grains, right, from my 1980s.
Right.
And I thought I was on the right path. But this tells me that people can be re-educated with science and hopefully then set on a new path, which, by the way, I see every day in my practice. I'm hoping we can catch people before that pivotal change moment where it takes something life-threatening, such as a diagnosis of breast cancer, to make you pivot and reevaluate how you've been living and thinking and drinking and moving. But at least I know that people don't know. Does that make sense? So that once we educate them, they can have an aha moment like I had and just embark on a whole new strategy.
Exactly. Yeah. I'm glad you're putting a positive spin on it. Yeah. So tell us, what percent of breast cancers are potentially preventable by lifestyle?
Right. If I were in a court of law, I would tell you 40 to 50%. I can prove that repeatedly in the scientific literature. But I also think some of these studies, they limit it. It's fine because they hit the big boulders, but they're talking about if you avoid smoking and excessive alcohol, exercise regularly, aren't overweight, and eat a predominantly plant-based diet, all of the big heavyweights, super true. The science will then show about a 40 to 50% drop in breast cancer. But there's so much more in the nuances of like, what exactly does plant-based mean? And how are you exercising? Are you exercising enough? And what are you considering an adequate body weight? And are we considering muscle weight versus adipose? And so there's nuances in that. And then there's a whole category of other things that are very much under your control that have a lot to do with breast cancer causation. Everything from exogenous estrogen use, which I'm soft on. We can talk about hormones later if we want, but HRT and birth control, small contributor, environmental toxicities, right? We live in a barrage of chemical nastiness, but there are certain things we can definitely control that we are consuming or putting on skin or using as detergents and soaps and perfumes and cosmetics. And so you get these endocrine disrupting compounds in your life, emotional stress, a lack of understanding of how fasting plays into changing the levels that matter to help your immune system do what it's supposed to do. Levels of estrogen and growth factors like IGF-1, inflammatory markers. All of these things can be manipulated first by the plant-based diet, and then not only what you eat, but when and how long you don't eat. So the fasting comes into play. Restorative sleep, which is a big component of lifestyle medicine. So you can get into cell rejuvenation and repair, microbiome alterations, so you can manipulate your microbiome so the critters in there are actually producing healthy anti-inflammatory molecules that then change the balance inside of you. So I mention all of that because none of that is then looking at the study that said, yeah, you could probably decrease breast cancer by 40%. I really think it's a solid 80% and perhaps more.
If you have those components,
If you go through, yeah, the whole list I just rattled through
right. Yeah,
and
exactly.
really kind of perfected it. It's still not a magic protective shield against any breast cancer. I certainly have the 30-year-long vegan who shows up in my office with breast cancer. So, you know, you can't kill everything with kale, but I do think it goes a long way to making the cancer that does form, should it form, very curable. It tends to be, and I have vast experience with this now, that the healthier the person is, the cancer that they get is usually, and not always, and you always have that one person typing in the thing right now, that
Yeah.
that theirs was triple negative and horrible and aggressive, but then also we need to eliminate genetics. Inherited genetic mutations is a whole different ball of wax in terms of the biology of the cancer you are prone to get. But the long and short of it is the healthier your life, the more primed your immune system is to take this cancer on and to win.
Yeah, good. Let's talk about diet a little bit because that's one of the boulders, as you call them, the four boulders. And first one we talk about is diet, nutrition. Couple of things. One, clarify what you mean by whole food plant-based diet versus maybe just vegan or vegetarian. And then tell us what are the components of that healthy diet that you recommend?
Yeah, terrific. So by whole food plant-based, if we break down the words whole foods, they don't really have ingredients lists when you buy them, right? So you're
Right.
getting an apple, you're getting some bok choy or some kale. So they are foods that can be, I don't care. We can talk about the nuances of this. I don't think like raw diet is definitely like where it's at, but things can be raw, they can be steamed, they can be sauteed, cooked, roasted, right? But they are actual foods that just came from the earth that way. And you can blend them and minimally process them, et cetera, to make them delicious. But that is what whole food eating is, as opposed to ultra processed foods, which contain a lot of other additives that we don't need. There's no health benefits to the majority of those salts, oils, and sugars that are added. And then they're so processed, they're refined, and they pull out the fiber. We can talk about processed foods more later, but by whole food, I just mean that you're eating foods that came from the earth the way they came, and then you modify them as you cook. But that's what the majority of your diet consists of.
Good. What are some of the components of the healthy diet that you recommend?
Right. So at the tippity top are going to be your fruits and vegetables. Dr. Hollie, I don't know if you pay attention to my Instagram, but I did put a little shout out to our time together today, and I put a bunch of little emojis that had a ton of vegetables. And I said, hey, one of these is more anti-cancer than any of the others. Like, which one do you think it is? And I said I would reveal it on the show today. So we will get to that in just a second, pins and needles. But it's in the fruits and vegetable category. And the magic in fruits and vegetables is, I mean, multifold. There's tons of fiber and water, but it's really in the phytochemicals. That word chemical sounds awful, but it just simply means that phyto, plant chemicals, have a molecular structure that once you just chew and swallow, you don't even have to understand what's happening. Just chew and swallow the right thing. And this phytonutrient, this chemical, will get absorbed by your bloodstream and start to bathe your cells. This is what a tumor microenvironment is like. You want to think of it kind of like a little bathtub that your cells are sitting in. And that water is either screaming out pro-cancer or anti-cancer. And it will scream in the form of phytochemicals. It will be providing nutrients and blood flow and growth promoters that enhance a cancer's ability to proliferate in place and then eventually get big enough to go straight out blood vessels and metastasize. Or the foods you are eating will be doing the opposite inside that bathwater, right? It'll be decreasing estrogen levels, This is an important molecule to understand because 80% of breast cancers are fed and fueled by estrogen. It'll decrease IGF-1, insulin-like growth factor. This is the biggest growth promoter hormone inside our bodies that screams at everything to grow, which is beautiful because we actually turn over 50 billion cells a day and IGF-1 replaces them. But whenever you eat animal protein, you're going to skyrocket your IGF-1 above and beyond the daily turnover needs. And it doesn't know it's not needed. So it's still going to scream, hey, you grow some fat around the middle or under her chin. She loves it right there. Grow some fat there, or grow some plaque in those arteries, or grow some cancer in that breast, or, oh, it's already there. Let's just grow it out into the liver. And I mean it. This is what IGF-1 does. And what you're eating either lowers IGF-1, lowers estrogen, lowers angiogenesis, angio blood vessel, genesis birth, the birth of new blood flow. All cancers, any origin, require angiogenesis if they want to grow bigger than about 2 millimeters, like the tip of a ballpoint pen. So you can eat in ways that are very anti-carcinogenic, anti-proliferative, anti-estrogenic, anti-angiogenic, or you can eat in pro ways, which is not going to be good for you. So back to our fruits and vegetables, these phytochemicals are fighting on your behalf when you chew and swallow them down. And there are some categories that have like the kings of them all in them. And now I'll answer my Instagram question. If you look at cruciferous vegetables, they are masterminds with anti-cancer properties. Like they literally have the ability to seek out and destroy cancer cells through largely a phytochemical called sulforaphane. And another one called indole-3-carbinol will take excess estrogen and make you excrete it through your kidneys. So our cruciferous vegetables are broccoli. Broccoli sprouts actually have 100 times the content of sulforaphane than broccoli, cauliflower, kale, Brussels sprouts. All of these cruciferous veggies are amazing. There was one really nice study because of its volume of participants, 52,000 African-American women were followed for 12 years, and they saw that 6 servings a week, so just under a serving of cruciferous veggies a day, led to 41% less premenopausal breast cancer. So these vegetables are super powerful, but their power is not usurped by the number one heavyweight. In all of our food categories, the allium vegetables win. So allium is our group with like garlic, leeks, shallots, green onions, chives. So we might think of them more as condiments and flavorings that are herbs and spices category, but they're actually vegetables. And there was a fabulous study that I love that took 32 different extracts of vegetables and dripped them onto human breast cancer petri dishes filled with human breast cancer. They actually did it for 8 different types of breast cancer, but I only focused on the breast one. I didn't even look at the other 7. I'm so breast focused. I just think about breasts all day and night. So we had these petri dishes, right? And we sprinkle food extracts. They're all vegetables. And a word to my mushroom guessers out there, mushrooms weren't one of the 32 vegetables. So maybe mushrooms would have won because they're pretty darn powerful. I actually have this one study in mind where mushroom eaters, I can talk forever. I'm sorry. I'm not. Okay. The mushroom, the white button mushroom, the cheapo little, like nothing chanterelle, portobello, fancy, expensive, cheapo white button mushroom, the size of the tip of your thumb, 10 grams worth, like a half a button a day, decreased breast cancer by 64%. So I wish they had dripped it on, but they didn't. So the winner goes to garlic and onions. And when they did the dripping, if I could show you the graph, you would see like they had like the quantity of breast cancer cells, and then they dripped carrot and it went like, whoop, or they dripped green lettuce and it went, whoop, and then they dripped broccoli and it went, whoop, and then they dripped onion and it was just like gone, like can't even see it. So those are the winners. And so fruits and vegetables are primary in terms of what is a whole food plant-based diet looking like. In terms of the fruits, again, anything is great. Bananas, papayas, apples, oranges. We don't have to get expensive and fancy. But I will say that if you want to pick winners, berries win. Yep. They are packed with fiber, but also these phytonutrients. You get about 6 to 8 grams of fiber per cup of berries, which is great. We can wax on forever about fiber, but it is a very under-consumed nutrient in America. So we want to get it wherever we can, and berries are a great source. But more than that, they're a beautiful source of another phytochemical called anthocyanins. And cyanins, yeah. Some things are a tongue twister. And they really have shown the ability to inhibit cancer cell growth. There was this one 2020 study that identified 8,900 breast cancer patients from the Nurses' Health Study. This is a big cohort of nurses that were followed for ages. And so they cull so many like different studies out of the Nurses' Health Study. So don't think whenever you hear that, you're like, oh, I know that study. Like there's like 1,000 papers based on the Nurses' Health Study, right? So anyway, this particular angle was looking at berries, and for every 2 servings per week of blueberries, there was a 25% decrease in breast cancer specific mortality. And it really probably has to do with these anthocyanins that are in berries. They're just so powerful. So, okay, moving on. So we have our cruciferous veggies, but all veggies are awesome, of course. That's where Eat the Rainbow comes in. You don't want to miss out on any of the phytonutrients. So just they're mostly stacked in the color. And just side note, except for beets, really, when can you like over consume food and then be like, well, my urine is blueberry colored? Like you just, so the power of the food is in the color and largely in the skin, although it's in the flesh of the food too. But so whenever possible, you're not going to eat watermelon skin or banana skin, but whenever you have apples or potatoes, like you want to eat skin because that's where the phytonutrients are most concentrated. Or if you're having an avocado, oh my gosh, we have a green barrel. It drives me bananas. The boys will take an avocado. I have to teach them just how to deal with an avocado. They will like scoop out the middle and then just like throw away like all the avocado that's like against the skin, which by the way, I know. You'd think being my sons, they know better, but yeah, I will like a slightly psychotic mother, pull it out of the green barrel and be like, who sliced this avocado? I want to know. But mostly, besides being a waste of money, it's a waste of great phytonutrients because the closer you are to the skin on the avocado, the richer the phytonutrient content. Just sidebar. Yeah. Okay, so moving on, we have whole grains. This was tough for me. I said it several times now, and I'm going to say it again. When I was growing up, man, pasta, rice, like that was a no-go. But then when I did my deep dive, that's how long I went till I was almost 40. No, I was 40. Who am I kidding? It was like 45 when I realized, maybe I should rethink this. Whole grains are far different from white rice or enriched wheat flour. Your whole grains are going to be whole wheat, whole grain oats, barley, whole wheat, brown rice, whole wheat couscous, farro. There's so many delicious grains out there. And I was largely unaware of things like freekeh and amaranth and teff. And I went out and I like bought them all. And I started to experiment with cooking and got so excited about how delicious and nutritious all of these whole grains were. And a lot of it, initially for me, even doing my study, I thought, well, yeah, because it's high fiber and that's great. Fiber is a prebiotic for your little microbiome critters. But really, until I started studying fiber more, I thought it was just about like, I kind of had fiber, Metamucil, poop, like just all about a good old bowel movement. And it is partly about that, by the way, bowel movements to bulk up your stool and also move bile and bile salts out of your GI tract because they can get they could get taken up again through your colon, through the wall of the colon. It's called the enterohepatic circulation. It gets pulled back into the bloodstream and back into circulation where they go straight to the breast and are highly toxic to breast cells, estrogenic and carcinogenic to the breast cells. There are interesting studies I could go on that prove that point, but then we'll be here all night. So the point is, poop does matter. It keeps bile salts moving and it actually binds estrogen and poops them out, the excess estrogen out. But the things that are particularly interesting to me are all the new studies coming out about the microbiome and how that affects our overall health. And one of the things fiber is a food for your little gut microbiome critters to munch down on. And then they end up releasing short chain fatty acids, things like butyrate, propionate, acetate, these things in your bloodstream are extremely anti-inflammatory. So much so that there was a 2024 study of poop looking at the stool of breast cancer patients, and they found that they had much less butyrate than the controls who didn't have breast cancer. So in other words, they weren't eating that prebiotic fiber that allowed their bacteria to create the butyrate that is so anti-inflammatory and anti-carcinogenic. And if you look at animal models, which I am not a fan at all of experiments in animals, but when the literature's there, I'm still going to look at, well, what they find. They already killed the mouse. But they found that in animal models, butyrate can literally just halt the growth of breast cancer cells inside animals. So the other thing for my triple negative patients or just estrogen negatives out there listening, the high fiber studies almost show an equal or even greater quelling of estrogen negative tumors, as much or more so than estrogen positive. So fiber through whole grain consumption, fruits, vegetables, all great. Healthy fats. We can get into more about fats, but I have I have three, I get this in my body every single day foods. And one of them is in our healthy fat category, and it is flax seeds. It is 1 to 2 tablespoons of ground flax seeds every day, 1 cup of raw or lightly steamed broccoli every day. I do always constantly have like raw onion and stuff sprinkled onto whatever I'm eating every day, but that's not one of my go-tos. My third is a soy product, usually tofu, every single day. So those are my top 3. And so the flaxseed goes into healthy fat. Flax, you may or may not know, is the highest concentration of healthy omega-3 fatty acids on planet Earth. But more interesting for the breast realm is that it's very, very high in lignans. Lignans are plant-based estrogens, phytoestrogens, that have been linked directly to lowering breast cancer incidence and recurrence and death. So we want to get lots of lignans, and flax is the best way to get that. And then finally, 2 more things. Legumes. This is our great protein category. Legumes, lentils, beans, peas, seeds, nuts. So flax would kind of fall into that under the healthy fats. But this is where we get our main sources of protein. And then I'm big on hydration. So lots of water. And then if you're bored with water, I'm a fan of coffee, probably before 2 p.m. if you want to sleep well, because that's another component of health. And green tea and hibiscus tea, but green tea, the EGCG, another chemical, EGCG, epigallocatechin gallate.
Well said.
Thank you. That, so fascinating. Literally, again, sorry, it's in mouse studies, but it has been shown to take a wad of breast cancer stem cells, right? Stem cells are like the little masterminds behind all recurrence and death. Injecting EGCG into mice that have breast cancer stem cell tumors grafted onto them shows in a 3-week period of time that cancer wad will go going, gone. That's the power of green tea. So those are my choices for drinks for you: water, green tea, and coffee.
Excellent. Excellent. You covered a lot of stuff, a lot of important things. Just kind of want to clarify really quickly for some of those that may not know, but fiber is only found in plant foods, not in animal foods. And you didn't hear Dr. Funk saying, oh, you need to take a supplement with anthocyanins or sulforaphane. You heard her say the whole food, because that's where the power is, in the whole food. Yeah. So, yeah, so we need to move along here. I want you to spend a little time talking about the things that we need to be avoiding, specifically, animal foods, animal protein. Talk about what we need to avoid, and include dairy in that answer too.
Okay. Yeah. So we definitely want to be avoiding, I mean, it's kind of inarguable that processed meat and red meat is just bad for you, because the IARC already did this work for us in 2015, right? In case you don't know, the IARC, International Agency for Research on Cancer, is an agency, part of the WHO, the World Health Organization, that is not bought. Okay, there's nobody in their back pocket like Big Dairy or Big Beef saying like, let me slip you a little hundy here and just come out saying it's okay, don't be concerned about this. And this particular year, it was July 2015, you had 22 scientists, researchers from 10 different countries, and they had to pour over 800 epidemiologic studies to simply answer the question posed to them, which was, do red meat and processed meat cause cancer? And so after they did their research, they came out and said, absolutely, all processed meat. What's processed meat? It's like sausages and hot dogs and bacon. But guess what else it is? All the deli meat, all the slices, everything on the charcuterie board, even your organic turkey breasts that you get from the deli for your sandwiches that you're feeding your 7-year-old sons. Oh, wait, and I'm talking about myself right now. That was me when I read the study. It's a whole story. But the point is, that's processed too. And they said it is absolutely carcinogenic to humans. No question. Red meat, probably carcinogenic, and we do have strong evidence that it at least causes colorectal cancer. So here's an example of a study. It came out back in 2014. They followed over 6,300 adults for 18 years. So this is a large volume study, long time, almost 2 decades, and they were all over 50 years old. And what they found is that the people that were between 50 and 65 years old, the higher the animal protein levels, so the highest versus lowest animal protein consumers, not animal protein versus vegans or plant-based eaters, just highest versus lowest, you all eat animals. The highest group there had 430% increase in cancer death.
Ouch.
And a 7,300%, like these are crazy numbers. It is a 74 times the likelihood of becoming diabetic.
Ouch.
And
Ouch.
all of that was tracked back to the IGF-1. So we talked briefly about that sinister growth hormone that's catapulted inside of you when you eat animal protein. So wherever meat goes, IGF-1 goes, and then the cancer and the diabetes are soon to follow. So really, it's not just red and processed meat, it's all meat, chicken, turkey, fish, and dairy, milk, butter, cheese, and eggs. So when you ask, like, what about dairy? This is more nuanced. If there's a hierarchy of things, like if someone's like, oh, heck no, doc, I can't do this whole vegan thing. Then I kind of look at each meal. Let's just take a day's worth of meals and let's see what we can pluck from the plate or substitute that will be more acceptable to you. And we'll just, baby steps toward it, which is fine. It's still an improvement. You were basically getting a D before, and I've moved you to a B minus. I'm proud of myself and proud of you, right? Like that's the attitude I have. So dairy, is the studies are varied. So in terms of cancer causation, they land like showing an increase, and I could pluck those out and wow you, or sometimes they show a decrease and sometimes they're neutral. And when you do look at these meta-analyses that then try to put all the studies together to make power in numbers, they kind of come out pretty neutral on it because each study can be pro-cancer, anti-cancer. And I think I know that the reason that happens is you have a mixture in your dairy. You have some healthful things like calcium and vitamin D and butyrate, linoleic acid, and then you have some awful things like animals pumped with excessive hormones. Dairy, you have to realize, always comes. When do you women make milk? You just gave birth to a baby. So these cows are constantly inseminated, pregnant, or just birthed a calf. And if they're not in that window, they're killed. Like their only purpose is to be pumped with hormones artificially. And if it's organic, they're not necessarily pumped with hormones, but they are hormone machines because they're pregnant with astronomical levels of estrogen, well, not even like 10 times normal, right? So the estrogens in a cow are stored in saturated fat. So the fattier the dairy that you're consuming, then the more likely we are consuming the animal-based estrogens. But then they also have things like aflatoxins and saturated fat, and it increases IGF-1, right? So I can tell you about a few studies when I look specifically at dairy and breast cancer. The overall health and cancer connection gets murky, but I think when we target breast, we'll find that dairy does not do a breast any good. One study, oh, actually, Dr. Hollie, this is out of your alma mater, Loma Linda.
There you go.
Yeah. So it's a recent study, 2020. I love it because it's so multi-ethnic. It had just over 52,000 North American women followed, and 29.7% of them were Black, which is always like nice to see our sisters represented in studies. So they were followed for 7.9 years, and nobody had cancer. In the follow-up, 1,057 new breast cancers were diagnosed. And when they started to compare nutrition, surveys were given throughout, and they looked at the highest versus lowest dairy cow milk consumers, 90th versus 10th percentile in consumption. So again, not bringing plant drinkers into this. They found a 50% increase in breast cancer for the highest milk consumers. Full fat and reduced fat milk consumers had the same increase. So in this case, the fat didn't matter. There's other studies that have saturated fat as being more sinister. That same study, interestingly, if you substituted soy milk for an average amount of consumption, so your median consumption of soy versus your median consumers of dairy from cows, the soy milk consumers had a 32% decrease in breast cancer versus the dairy. So that's one powerful study. Another one I love is called LACE, stands for Life After Cancer Epidemiology Study. This one followed 893 breast cancer patients for 11.8 years, so good decade plus. And listen to how minor this is. Those breast cancer patients who ate just one or more servings of high fat dairy, this is where low fat didn't have any significance statistically, but high fat dairy, one or more servings versus a half a serving or less of high fat dairy. So again, we're not comparing to vegans. In those people, they had a 49% increase in mortality from any cause, including breast cancer, just from one or more servings of high fat dairy. And then another study showed, again, just in breast cancer patients, that those who consume butter, margarine, ding, 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 because now we have a plant-based fat, or lard on a daily basis, had a 67% increase in their cancer coming back. And between the highest third and lowest third of fat consumers, a 212% increase in death. So I highlight this because margarine, here's like a little secret if you're unaware. If anything says hydrogenated on your label, a hydrogenated oil is a trans fat. Trans fats are largely just thought of as coming from animals and animal products, from the meat itself or dairy. But you can make it out of a plant too by hydrogenating the oil, and then it has all of that artery clogging, inflammatory, horrible effect, just as if you'd eaten lard.
Ouch, ouch. Yeah, so we have 10 minutes left, so I need to cover a couple of really important things. You mentioned the soy word. Clear up the controversy, because, I had a patient yesterday said, soy causes cancer, doesn't it? So talk to us about soy. I know you've had a journey with soy yourself.
I have. So embarrassing. So, okay. I was a fellowship trained breast cancer surgeon for 18 years, 8 years ago when I was writing my book. So for 18 years, ladies, and I'm sure men out there, I told every patient, and certainly I told every breast cancer patient, and I warned others, spit that soy out of your mouth. Don't you know it's an estrogen, and estrogen feeds 80% of breast cancers? And what are you thinking? And just stop the soy right now. So when I wrote the book and I was coming into my little soy section, I couldn't wait to bring on the science and tell people why they should avoid this soy. And when I went into the science, I realized that the way I had gotten that notion was, first of all, yes, there are phytoestrogens, the isoflavones like genistein and daidzein in soy exist, but here's what I didn't know. There are actually 3, but we only really care about 2 estrogen receptors inside of us, alpha and beta. Alpha is on the cancers, and when it's hit by estrogen from your ovary, from your milk product or eggs. Oh my gosh, 10 eggs have the equivalent of 1 birth control pill worth of estrogen. Just side note. Anyway, so estrogen hits the alpha receptor and tells the cancer to multiply and divide. Turns out with 1600% more affinity, the phytoestrogens in soy zip over to the beta receptor. And what happens when beta is activated is fascinating. First of all, it shuts alpha down. So now there is no way for your own estrogen to fuel the cancer. Second of all, it goes out into your fat cells where you have another enzyme called aromatase, busy turning adrenal gland steroids like testosterone and androstenedione into estrogen. It turns off the fat enzyme that's making extra estrogen. So in point of fact, if you look at every single human study ever done looking at soy consumption and breast cancer, you will never, ever find a single study that shows an increase in breast cancer. And the vast majority of studies show somewhere between a 25% and an astounding 60% decrease in cancer forming in the first place. The earlier, the better. There's one fabulous study looking at adolescents and soy consumption, and it has a remarkable 40% drop in future breast cancer risk. Then a drop, again, between 25 and 60% in breast cancer recurrence. So this is a superfood for my estrogen positive breast cancer patients out there. And a 25 to 60% drop in death from breast cancer. So soy is an absolute superfood. I think the bad rap, I know for me, just came from a couple of studies again in those poor mice that were grafted with the tumor cells, fed soy, and then guess what? The tumors grew. And we just extrapolated that to be evidence that soy would grow tumors in humans. And it turns out we humans metabolize isoflavones very differently than mice do. And we're having this opposite beta activated effect. Soy is a superfood. Please stop persecuting soy.
Excellent. Thank you. So we should consume soy. Verdict is in.
Organic. We want to avoid the glyphosate.
Organic, yeah, non-GMO. Good.
Yeah.
So I'm going to challenge you. We have about 7 minutes. And one thing I really want to make sure we cover is what % of breast cancers are attributed to our genes, and work in epigenetics there and why it's important.
Right. Okay. So if about 5 to 10% of all breast cancer patients have their breast cancers largely because of an inherited gene mutation from mom or dad. We're talking about BRCA or BRCA1 and 2, CHEK2, PowB2. There's a handful of them, about 19 genes that we know increase the risk of breast cancer because you are handicapped in your ability to repair DNA when it goes awry. 5 to 10%. That's it. In fact, if you look at all breast cancer patients, 87% of breast cancer patients don't have a first-degree relative with breast cancer. About 80% of breast cancer patients don't have any relatives with breast cancer. So now we're kind of coming down to those numbers where I said what percentage I think is completely preventable through strict attention to diet and lifestyle. And I know it's 50%, but I feel like it's upwards toward 80+%. And this is why, because the genetics that truly handicap you, it's not like a fait accompli that you'll get breast cancer if you have a BRCA gene mutation, but then there are, by the way, like 1,000 different BRCA mutations. So it could be a specific mutation in the Ashkenazi population has upwards of 87% lifetime risk of getting breast cancer. To be in the 13% that escapes it is like a slightly risky gamble, but the older you get, the more you've escaped that risk, either knowingly or unknowingly, because you didn't know you had the gene. All the other gene mutations have usually a much less penetrance than that. So maybe somewhere between 25 and 60% chance of breast cancer, which gives you a fighting chance to eat and live in a way that you never get breast cancer. And we just do high-risk surveillance. It all becomes an individualized discussion. But the main point here is that 90% of people don't have these gene mutations. So what they have are epigenetic mutations. Epigenetics just refers to these environmental exposures, things like tobacco smoke, UV radiation, medical radiation, toxins, infections, so exposures, and choices, which we've kind of glossed through already, but we're making choices every time we chew and swallow. So it has a lot to do with dietary factors, weight, your choice to exercise or not, your choice to smoke and drink alcohol directly or not. I had mentioned tobacco, but that would be like potentially secondhand in an environmental situation. And then you have a choice about being a smoker or a non-drinker or minimizing your alcohol. All of these alter oncogenes. So we have these genes throughout us. Um, proto Proto-oncogenes are behaving normally. They're fixing DNA when it goes awry, swoops in and methylates things that it doesn't want to divide anymore, and it just creates control. Like, for example, there's a reason why your cells don't break a barrier, get into the bloodstream, and start flying places. It sounds like metastases because that's what cancer does, because it breaks away from the natural controls of your body. But your normal cells listen to the signals. An oncogene is altered by epigenetics in a way that's just like we push on the gas and it's proliferating and dividing and it's not listening to anything anymore and it's getting into the bloodstream and it's metastatic. Like it's just on full throttle. And the beautiful thing about epigenetics is that you can manipulate them. You can reverse these mutations and alterations. You can rectify them with improvements in your exposures and in your choices.
Excellent. Excellent. So with our last couple, 3 minutes, I want you to first refresh our memories with those 4 boulders that you recommend for everyone for prevention.
Yes. So the big boulders are to eat a whole food plant-based diet, to exercise regularly, to minimize or eliminate alcohol, and to maintain ideal body weight. Each of those 4 things in the opposite spectrum, so eating animal protein and animal fat, being overweight or obese, drinking excessive alcohol, and not exercising, being sedentary, all have really catastrophic effects on that bathtub water, on that microenvironment. So we want to focus on the boulders before we get too obsessed with things that have no bearing, like underwires and bras, or things that have minimal bearing, like hormone replacement therapy.
Right. And then the smaller boulders that you mentioned are environmental toxicities, emotional stress, lack of fasting, poor sleep, all those things as well. So with our remaining 2 minutes.
You're so mindful of the time.
Well, Natasha makes us, but here's what I want you to cover. Number 1, your projects. Pink Lotus. Tell us about Pink Lotus and your book and all of that. And then the last thing I'll ask you is about your family. So go for it with your projects.
All right, great. So I'm always working on my Pink Lotus Power Up. You can go there for free. It's a community that's live online, and it's just a beautiful way to connect with others who are like-minded. And then there's a smaller subsection called Breast Buddies, and it's just for the cancer patients out there. They don't have to be my patients. And I love Breast Buddies because you go in and you put in your information, like I'm 42, I have stage 2 breast cancer, I'm doing a mastectomy and chemotherapy, and I was just diagnosed. And like Match.com for breasts, it'll bring up someone who's already been there, done that, but she's plus or minus 5 years your age. She also had stage 2. She also did chemo. She also did mastectomy. And she's there because she wants you to connect and reach out and chat with her. And she's the wealth of info that your doctor will never be able to share with you because she's gone through exactly what you're about to go through. So that's a beautiful thing. On there also in Power Up is our Cancer Kicking Kitchen. I have a lot of recipes, and then my BFF Chrissy and I do a monthly live cooking demo to show you how delicious plant-based eating can be. And my spin on it is that I'll like deep dive into a few ingredients to show you the power of that food, and then maybe spotlight also how best to cook it so you get maximum benefit from it. So it's just a fun, different way of looking at how to make food and make it so powerful inside of you. My book is available in 13 languages. I actually have no idea where you get most of those languages if you don't live in Russia. But but just go to Amazon and look for my book, Breasts, the Owner's Manual. And it really does. It was such transformative work for me, and it's been a Bible for so many women with breast cancer. It's been just really so touching to me to know that it helped people navigate their journeys with wisdom and power in a way that they probably wouldn't have reached on their own or with the help of their existing physicians. So please use that as a resource. It makes a great gift for someone newly diagnosed. And I do have an annual summit called Cancer Kicking Summit that is in different parts of the country. So just head out to the website to see where we're going next. That this current thing was actually, it was in May and we had to postpone. The Palisades fires like did a whole number on us, but it doesn't matter. We will be back and better than ever, but it's a really fun summit because I dive into all sorts of fun aspects that go way beyond nutrition and the boulders. We start to talk really deeply about thoughts and mindset and create action plans that you can take home with you and really just revitalize and transform your life to be the most powerful it can be.
Excellent. The last question is tell me about your family and what are your passions? What keeps you going? Because
Well,
you do a lot of things. A lot of things.
honestly, I think what keeps me going the most are my two biggest passions, which are my family, my kids, my husband, and killing cancer. I'm just really passionate about killing cancer. I thrive in journals that just tell me about one more weapon I can bring to my patients. But the kids are my pride and joy right now. These triplet boys that went vegan when they were 7 are now 16. And one of them, I'm super proud of my boy Sebastian. You can follow him, Flat Out Funk. He'd be super excited that I told you he just put up on Instagram, for better or worse. But he just made Team USA in cycling. So
Nice. Wow.
yeah. So we'll see if he eventually makes our LA Olympics. But he's a super cyclist. And the other two are amazing runners. And my husband is a full distance Ironman and does like Kona and now Nice, if you know the Ironman world, now moved to Nice instead of Kona every other year for men. Anyway, so they're all like super athletes and I just love to get home and be with them and feed them. And I do half Ironman, but it's not nearly impressive as all these other people in my life. So
Still impressive. And you're a boy, 15 years of age and cycling, man. That's amazing.
be strong, yeah.
Amazing.
Which shows you, yeah, you can be strong on plants.
Yeah, absolutely. Yeah. So we're going to bring Natasha in and do some Q&As. But Natasha, I get the first question because there are a lot of questions I didn't get to talk about Dr. Funk about. I think this is an important one for everyone in the audience. My question, and then I'll turn it over to you, is what do you recommend, Dr. Funk, as far as self breast exams and mammograms?
Terrific. So as soon as you're going through puberty, it's not because I think a 14-year-old's gonna feel or find a breast cancer. It's that I want, as young as breasts are developing, for you as young women and young adults to be completely comfortable and familiar with the lumpy bumpiness of your breasts. So if you go to easybreastexam.com, that'll just take you to one of my Power Up blogs that has a 5-minute video that I made that teaches you how to do an excellent self-breast exam. You will definitely learn a few tips and tricks that you are not currently doing. I like for women to do monthly exams. If you still bleed and have periods, you want to do it 7 days after your period starts. That's when you're going to be least lumpy and tender, so it's easier. And if you are already menopausal, then once a month on the first of the month, just sort of check it off on your calendar and do it once a month. I think that self-breast exam is really critical. If you know what you're feeling for, it can be powerful. I've had way too many patients find their own breast cancers to dismiss it, as many of our major societies do, by the way. The recommendation is to not do self-breast exam, that it engenders too many false alarms, that you go flying into your doctor over nothing. But I think that's a little patronizing, and it's really just because women aren't taught how to do a good breast exam. But you're with your breast day and night 365 a year, right? Your doctor sees you once, twice a year, 5 minutes. And how long is their breast exam? So take it upon yourself. And then for mammograms, a lot of controversy here, and I acknowledge that and create individualized plans. But overall, to save the most lives, you want to begin mammography for normal risk women at age 40 and don't stop or skip years. Do them annually until your life expectancy is less than 10 years. That's super difficult to predict, but you could probably stop around age 90. But honestly, every year, that's what I recommend.
Great. Natasha, what do you have?
Well, that's okay. You took one of my questions, so that's all good.
Good,
All
good.
We're seamless this evening. So I want to say for all of those who have been putting questions in, because we've had a lot of really stellar questions, that we're not going to address questions related to personal medical diagnoses just because we don't have your complete history and all of that would be very difficult. But we will be sending a list of really great resources that you will probably be able to dig into and find the answers that you're looking for.
Yeah.
And additionally, I would encourage everybody to watch the replay again because you have provided so much good information, Dr. Funk, that I think I'm going to have to watch it several times just to grasp all of it. So that's wonderful. So this is, we'll start off with, I believe this is from a healthcare professional. Is there a clinical way to test for butyrate in stools of patients?
I think the Viome test for butyrate, which is a commercially available stool kit that looks at your microbiome analysis. So that is one thing you could look into. Yeah.
Okay. Totally off that topic. Tell us more about beets. This person said your comment suggests it's possible to overeat them. So tell us more about your relationship with beets and what you recommend to others.
Right. My relationship with beets was started about 30 years ago when my dad called me in a complete panic because he had had prostate cancer and he thought he was peeing blood. And I said, I know my dad, and I said, Dad, did you eat a bunch of beets yesterday? And he said, I did eat a lot of beets yesterday. I said, yeah, it's beets, Dad. It can be in your pee and your poop. And but that was the first time I realized people eat so much that it changes their, and I admittedly, you can turn your stool slightly green too if you go crazy on the salads. But that's all it was about the beets, is that I was trying to make the point that phytonutrients are in the skins and in the color, and you don't pee or poop a rainbow. It's always the same basic colors because you're absorbing the color and the nutrients, but somehow the beet pigment just makes it through.
Gotcha. Thank you so much for that clarification. Let's stick on the nutrition side of things. So someone is asking about matcha tea, especially because it's so popular. Is that comparable to green tea? I mean, what would you say to someone?
Matcha is the highest form of green tea. It's the best. So it is the whole leaf ground up. So when you use a matcha powder, you can make it as a tea, and whisk it, or I throw matcha into my smoothies just to make sure I get 3 cups a day. I'm not a huge, confessions, I'm not a huge tea drinker. So I'll get the green tea in a smoothie to make sure I get it in me.
Gotcha. Great advice. So people are also wondering about organic. I understand the vegetable and the fruit thing, but do these need to be organic? Do you recommend organic? Can you talk a little bit about that aspect of things?
For sure. Whenever financially feasible, choose organic. Sometimes I'll be at Trader Joe's and I'm like, the organic bananas are 19 cents and the non-organic are 18. Like, I'm going to spend 5 more cents and get the organic. Sometimes it becomes prohibitive, especially if you're consuming berries in the quantity that I would love for you to eat, a cup or so a day. That now you're getting expensive. You can buy organic ones frozen, and that tends to be more reasonable. The problem with organic is largely glyphosate, which has the power of pure estrogen in a petri dish. Glyphosate dripped on normal breast cancer cells will turn them into breast cancer cells. So from normal to cancer in 21 days. So there is something very estrogen-like and powerful about glyphosate that in a petri dish, it doesn't look good. It's not well studied in humans, but best to avoid these pesticides that get into your food. I love the EWG, right? The Environmental Working Group, EWG.org. You may have heard they've got their Clean 15 and their Dirty Dozen. It changes annually because they measure the pesticide content. I actually was elated that this year, I think, strawberries are finally off the list. Like they're always in the top 12. So I do follow that. I look at the Dirty Dozen, and if it's on there, I just won't buy it. I'd rather my kids don't eat it at all, or I splurge for the organic.
So just to clarify, that glyphosate is a conventional pesticide that would be used in conventional agriculture as opposed to organic. So by buying organic, you are then, avoiding that glyphosate.
Correct.
Gotcha. Okay. And someone is asking, can you speak a little bit more about the connection of reabsorbed bile salts to breast cancer? You mentioned that briefly. Is there anything more you can do to expound upon that without going into a 3-hour lecture?
Well, the study that I was thinking about and didn't elaborate on, looked, it was done out of Harvard, I'm pretty sure. And what they did was they radio labeled bile salts and had women swallow them down. And then these women were found to have breast cysts, which are really common, by the way. Like 85% of women have breast cysts at some point. Those aren't cancerous, but they're fluid-filled little cyst bags that are easy to see on ultrasound and easy to poke with a needle and pull the fluid out. So 9 days later, they had the women eat these radio-labeled bile salts. 9 days later, had them come back. They aspirated their cysts and found the radio-labeled bile salts in the breast. So it was proving the point that these things that are swallowed down do get absorbed through the enterohepatic circulation and then make their way into the breast, where they're found to be directly toxic to breast epithelium. So that was that study. There was another study looking at, well, this isn't necessarily directly connected to bile salts, but they looked at super poopers, which would be a lot of us vegans, who pooped 1 or more times a day versus women who pooped twice a week or less. And in the women who didn't poop very much, they had 4.5 times the incidence of precancerous changes in their breast biopsies. So there's something, you know, presumably bile salts and extra estrogens are 2 of the main things that are getting excreted by frequent defecation that is going to be to your health benefit.
Thank you very much. Back to more of the food side of things. So people are asking questions, and I'm looking here and going through lots of them, is what if I'm allergic to soy? What if I'm allergic to alliums? What if I'm allergic to these things that you're telling me that are so fabulous? You know, is all hope lost? What do I do? How should I proceed?
Well, I think we have an allergist and immunologist in our midst. So I'm going to defer to Dr. Hollie. My initial reaction is to say, though, that I think we've learned, and Dr. Hollie, I'm going to let you kind of take it, but it's just because you're allergic doesn't mean you're permanently allergic. Like, you can retrain, right, to be able to safely consume certain foods. But Dr. Hollie, you're the expert. Why don't you answer?
Yeah. So first I would say, absolutely confirm that you are really allergic to soy or allium, you know, onions, garlic, leeks, shallots, etc. Because the allium family is a pretty uncommon food allergen. I've been doing this for, over 30 years. I rarely see an allium allergy. Now I see soy allergy mostly in little kids, and most of them outgrow it. With that said, occasionally I see soy allergy in adults, but confirm it. Go to a board certified allergist and confirm that you are really indeed allergic to those foods and not maybe just intolerant. Maybe if you are intolerant, sometimes cooking some of those foods will take care of the intolerance.
Or fermenting for the soy family.
Fermenting, yes, exactly.
So tempeh, miso, natto, those are excellent soy sources that are fermented and a little easier on your digestive system.
Yes. Good point.
Excellent response. That's great. Now, we can't have a discussion about breast cancer or breasts without talking about HRT. Can you give your thoughts on HRT as it relates to breast cancer and just in general, please?
That's a whole session right there.
I know.
It's a whole session.
Go, 30 seconds.
Okay, ready to go. Here's the thing. You're going to hear, it's a really very sexy right now to talk about HRT with very good reason. And I applaud all of the pioneers out there who are pushing this conversation back out into the mainstream, celebrities and doctors alike, because ever since the Women's Health Initiative came out in July 2002, which is literally the month, 5 days after I went into private practice as a breast cancer surgeon, this study, the big WHI, came out, basically, condemning all HRT as causing breast cancer, a 26% increase in breast cancer, which shortly thereafter was found to not be statistically significant, and then years later to not be even worth a mention. So there's a lot I could talk about. I'm just going to hone in on these 2 facts. Does estrogen cause breast cancer? A lot of people want to dismiss it and simply say no. And sorry, but the truth is it does. It's both mutagenic and carcinogenic. Estrogen mutates DNA and it propagates cells that are mutated into wads of tumor. So the good news is estrogen does so infrequently. And when it does, the cancers that are formed are generally less aggressive and more curable. So what this means to the women out there as a whole, with very few exception, although there are a lot of breast cancer patients, I individualize your breast cancer story to help you figure out whether it's safe. Is it safe yet for me to go on hormones? Just because you had breast cancer, even an estrogen-driven one, doesn't mean that you have to live a life fraught with misery. There are a lot of things that are obvious: hot flashes, night sweats, vaginal dryness, decreased libido, mood swings, dry skin, thinning hair, all of these things that people hate that are kind of, they're misery making. But then there's other things you didn't even know, like my heart palpitations, my frozen shoulder. I had no idea my high cholesterol, my visceral fat deposition, like this tummy that came out of nowhere. That's all menopause too. And those can basically be fixed by taking hormone replacement therapy. As a physician, I'm more concerned about things that kill you. I mean, all of that matters to me, but because it matters to you. I'm more concerned about what we know about how HRT is protective against osteoporosis. 1 out of 2 women in her lifetime will get an osteoporotic fracture. 1 out of 3 women over the age of 65 will die from that fracture in the next 12 months from something else like pneumonia, but it came from the fracture and the recovery. Lean muscle mass, strength, stability, your gait, right? And not falling to get the fracture. Being strong is a great predictor of longevity, and lean muscle mass is maintained by HRT. We know that your cardiovascular health and staving off heart attacks is helped by HRT in the absence of existing heart disease. So that's a caveat. If you have existing heart disease, if you have a history of blood clots, if you're dealing with a current estrogen-driven breast cancer or in the recent past, these are good reasons to stay away from HRT. Everybody else deserves a thoughtful, thorough conversation because benefit largely exceeds risk when it comes to HRT and your overall health.
That was an excellent response in a very short time. Thank you so much, Dr. Funk. We're going to wrap it up with one last question because I think there's a real mix of people here this evening. We've had questions about fish. We've had questions about dairy. We've had questions about a variety of animal foods. Well, what about just a little bit of that? Or should I have this? This last question kind of sums up some of that. So, how absolute do I need to be with whole food, plant-based? If I have an alcoholic beverage on a special occasion and I have eggs a couple times a month and, I have a slice of birthday cake with my family, can you kind of talk about that whole food, plant-based lifestyle and kind of what it really means to all of this?
Yeah, I love that question. And the truth is, like, those infrequent moments of consuming something that's not on, like, that's on the naughty list is not going to impact your overall health ever. I mean, it just isn't. So the birthday cake on your birthday is fine. The occasional egg isn't going to spike your TMAO, which, by the way, eggs do, just from an egg here or there, like once a month. The bigger questions that I get that I think you need to understand have to do with, but what about? That's what I get a lot. Like, okay, I saw your stats. I'm not eating red meat anymore. But what about chicken? What about fish? What about soft cheese versus hard cheese? Like, it gets really nuanced. And I think at the end of the day, you have to just come to terms with who you are as a person. I am that obnoxious person in grammar school who got 105 on the test. And that's because I got every question right and the extra credit. Sorry, skewed the curve. But no, honestly, like, that's, I just had this thought, like, why did you answer the question wrong? Just answer it right. And that's what happened to me when I did my deep dive. I found out about the power of nutrition and health, and I found that a whole food plant-based diet was the best. So why would I do it less than the best if I know that the best is better? But that's not everyone's mentality. So again, I had mentioned when I was chatting, like, if you used to eat like and get a D grade and now you're at a B minus, that's amazing. Like, major applause. And that's awesome. And maybe you can inch your way up toward a B plus. Like, it's so different for everyone. But I do have a reminder. And it's a quick 5-point checklist that I go through when I'm discussing with someone who says, but what about like fish? Okay. So here's the quick 5-point checklist. Number one, you have to realize that every time you eat animal protein and fat, there's a cellular response that you cannot control. That the inside of you isn't like, oh, but that one was pasture raised. Oh, but this one was killed humanely. No, doesn't care. It is the response to animal protein, and it is going to elevate estrogen and IGF-1 and insulin. It's going to create angiogenesis, inflammation, and create DNA disrepair. Okay, it's going to mess your immune system up. Period. Number two, the carcinogens that come from cooking, unless you're eating chicken tartare, which is, vomit worthy, you're cooking it. And no matter whether you're frying or searing or grilling, and no matter if it has that char on the outside or it's slow cooked like a chicken in the oven, it all forms heterocyclic amines and polycyclic aromatic hydrocarbons. It's inevitable. The combination of the creatine and meat and heat equals these potent, like the worst of the worst carcinogens. So that's a problem. Third problem, what's naturally in the meat? You're not going to get rid of it. It's naturally filled with saturated fat, trans fat, cholesterol, heme iron, and nitroso compounds. You're eating all of that down. What's unnaturally in the meat? Here's where you get into your fish specifically, right? You've got like dioxins, PCBs, microplastics, microbeads, mercury, all these things. But it's also pumped, unless it's organic, it's pumped with antibiotics and hormones, and then their GMO feed has pesticides and herbicides like the glyphosate we were talking about, which is all bad. And then finally, what's not in the meat. Every time you eat a calorie, it's a choice not to eat a different calorie. So whenever you're eating meat and dairy, you're not going to get certain vitamins like C, A, D, E, and K, and minerals, and the biggies, fiber and antioxidants. All those phytochemicals, it's in the name. They come from plants, phyto. So you're not getting any of the cancer-fighting powerhouses from your chunk of chicken. It's all in the side dish, which could have been your main dish.
Wow. Okay.
Yeah.
Can't top
That's
that.
my response. Wow. Excellent answer.
Excellent place to stop. So thank you so much for your time, Dr. Funk, and for answering all those questions rapid fire.
Oh, thanks, Natasha. And thank you so much, Dr. Hollie.
Absolutely. So for those of you in the audience that may, want to talk to Dr. Funk specifically about your case, your issues, go to her website. You can schedule an appointment with her, and she can help talk through some of these issues with you specifically. So pinklotus.com, right?
That's it.
Yeah. So Dr. Funk, it has been a true privilege talking with you this evening. You presented so much valuable science-based information. Everyone is going to want to watch the replay and take notes on what they may have missed. And that replay will be in your email box in 1 week, right, Natasha?
Next Wednesday.
There we go. So on behalf of the T. Colin Campbell Center for Nutrition Studies, thank you for joining us on Spotlight on Health this evening. Until next time, good night.